So today we'll be taking a look inside the 2026 State of Patient Communications Report. We're here because everyone in this industry is working incredibly hard to make healthcare easier to access, yet our newly released data highlights a massive gap. So 72% of patients are still giving up on care because they are experiencing dead ends and confusing paths to get to that care. So you are all managing massive, complex organizations, and often these dead ends are what happens when patient expectations aren't meeting the reality of some legacy workflows that truly weren't built for this era. So today, with experts from Inova, Wakefield Research, Pixel Health, and Hyro, we're going to dive right into these numbers and then also talk about some of these insights and the patient's lived reality and the insights that go along with it. So by pairing this data with this ground level expert analysis, we really want to move the conversation away from just looking digital towards really feeling, towards really this more actionable roadmap of agentic precision. So before we introduce the panel, I wanted to just go over some quick housekeeping items. So we are recording this session, and we will share the report and the recording from this session following the session. And we'll be using the chat as well throughout. And we will also have the Q&A at the very end, so please save your questions towards the end. So now that we've gotten housekeeping out of the way, I'm really excited to introduce our panel of leaders who will help us map out this roadmap. So we're going to do a quick round robin. I will start with you, Michelle.
Okay, great. Thank you. I'm Michelle Vassallo, VP of Operations for Inova Health. I'm a logistician of all the things with patient access, whether it's the acute care or the ambulatory side. And Inova Health is a 5-hospital system with large network of employed practitioners in the Northern Virginia, DC metropolitan area. Happy to be here today. Thanks for having me.
Awesome. Thanks, Michelle. Next, we have Paul, who will bring us the hard numbers for today.
Hi, I'm Paul Bragan, Senior Partner at Wakefield Research. Wakefield Research is a global market research firm that leads research for strategic insight and decision-making, and also for public release and for thought leadership. And we do this work for a range of clients, including 50 of the Fortune 100. I have been in the research field for over 25 years, and my team actually led the research that we'll be discussing today. So I am excited to get into some of the key insights that were uncovered in this study.
Awesome. We're really excited too. And next up, we have Jill.
Hey, everybody. Jill McCormick here. So grateful to be here with you all. I lead the accessible care as well as our product and design teams with Pixel Health. My focus is really on aligning technology experience and the clinical needs so that organizations can deliver more seamless care. Pixel Health is a digital strategy and transformation and technology company, and we really help organizations make technology work the way that it should. So for patients, clinicians, staff, et cetera. And so we do the work of connecting systems, streamlining workflows, and supporting everything from like major IT upgrades to the point solutions and digital tools you'll hear about, and as well as contact centers. Happy to be here. Thanks.
And finally, Daniel.
Hi, everybody. I'm Daniel Bentov. I'm the CPTO at Hyro. My passion is building reliable and large-scale technology and empowering our engineers and product managers to make bold decisions that eliminate friction for healthcare partners and customers. As for Hyro's AI agent resolve up to 85% of routine patient communications. We drastically improve operational efficiency for health systems, and we remove the chaos from the patient journey, ensuring people can get the care they need exactly when they need it. And I'm excited to be here. Thank you for having me.
Perfect. And now that we've met our speakers, it's time to dive into the data. So the core theme of this year's report really boiled down to this contradiction that we're seeing in the market. So to set the stakes for the rest of our conversation today, Paul, could you walk us through the foundational numbers behind this access crisis?
Yeah, I'd be happy to. So I want to share some of the key results from our survey. And this was a survey of patients and also of healthcare providers in the US. And we did that so that we could compare the experiences and the perspectives between these groups. So to start off, we saw that an overwhelming majority, 91% of providers report using AI. On the other side of that coin, nearly 3 in 4, so 72% of patients have delayed care because of the maze involved in getting an appointment. Most patients, 51% of patients, have actually abandoned the search for care, specifically because the appointment scheduling process was just too complex. And similarly, 2 in 3 providers, 64% of providers, feel that these types of delays with patients, they occur with frequency in their organization. So, you can see that there's definitely a disconnect when let's say, supposedly solutions are in place, but problems still loom.
So with those takes in mind, I'd love to get started on our first topic. And I'm going to hand this back to you, Paul. But our first topic is a great digital show. So Paul, can you keep us going and walk us through what that 2026 data is telling us about this disconnect?
Yeah, we see in our research that most patients, so 89% of patients, they perceive the provider as technologically current based on their patient-facing tools. And similarly, most providers, so 87% of providers, they rate their patient-facing technology as up to date. But behind the scenes, that engine appears to be stalling because 1 in 3 providers, 33% of providers, they admit that their legacy workflows are simply too outdated to effectively integrate with AI.
Thanks, Paul. So that data really highlights a frustrating reality for health systems. So they are pouring massive resources into care navigation and genuinely believing these tools that they're deploying. So Michelle, I'd love to kick it from you and here. So since these digital tools are clearly there, how should modern health system leaders really approach untangling some of those legacy workflows to start to eliminate some of those operational friction, some of that operational friction on the ground?
Yeah, so if we think about the way that AI works, and if you think about a member of your community, coworker in your organization comes to your health system and say, how do I get an appointment with GI, with neurology, with pediatric oncology? If your answer to that question is, it depends, that automatically leads you to a place where you're not going to easily be able to integrate AI into your workflows. So a big piece of the work, which is kind of scary for people because we think a lot about local control of schedules and extreme customization and how do we possibly balance a self-service model with an incredibly, subspecialist driven workforce. A lot of the times when we say the words standards or templates or expectations, it can be really scary to start with. So I think the most important things for health systems when you're starting to think about how do I modernize my workforce, which includes agentic AI, is thinking about, are you really ready to take that step? Do you have visionary leadership that's really embracing the use of technology? Do you have team members that easily use these tools in their everyday life? Are you able to draw parallels between the work that other companies and services do that really do align with healthcare? And one of the big things that I like to talk about when we're thinking about automating something is let's make it less scary. There's nothing more, sort of anxiety provoking than using a methodology that you're not comfortable with. How many people do you call in your daily life right now? Phone calls are not the norm right now, especially in a service or customer service orientation. So how do we bring down some of those levels of, anxiety and fear and confusion? And that really starts with tackling some of those big pieces. You need to think about in your organization, what are standards that are must-haves that really enable the technology to work? Where are those loops where you do want to go to a human first and or do you need to offload to a different system? And then where are those low risk, high friction, high volume pieces that you can really plug into different sources? With us, we use our AI digital assistants in scheduling, in routing, in refills, customer service inquiries, billing. So we've been able to see a lot of use cases to really kind of look at the 80%, and then you're constantly working on what is that 20% that sort of falls out. And so really, I think it's a great highlight to show that people are now recognizing that if you put good technology on bad processes, you just have really expensive bad processes. And so that's not going to work as you try and deliver the care that you need to and train these agentic agents to do the pathways that they need to complete. You have to understand what those pathways are, first of all, internally, and ensure that they're repeatable, reliable, transparent, and that really the organization knows the direction you're going.
Amazing. I love when you said to make it a little bit less scary, because I think that it can be very complex. So I think that that's really important. So Jill, how do we evolve that digital front door? So I think going into some of those scary processes, health systems have done a lot of that hard work to build some of those modern entry points. So how do we really design some of those workflows behind those processes so that we aren't just capturing patient intent, but we're actually taking action and resolving the need that they have?
Yeah, that's a great question, Ashley, and it sort of builds off of what Michelle just was mentioning. So when you think about that example that she gave of you're trying to get a GI appointment and the answer is it depends. Well, the front door wasn't the challenge. It was sort of everything that happens behind the curtain of that experience. And so one of the ways that we really approach this work is by identifying what are the highest value needs and intentions that patients need to solve for, and start thinking about it as a resolution engine rather than, as you mentioned, like an intake engine, which is how it currently sort of works, as you can imagine. And so really what we do is we map out what are those needs and intentions. And then as you look through that, it really crosses channels. So it's oftentimes that if a patient is looking to schedule, that it's multiple systems, multiple stakeholders. So if, again, that answer is it depends, then it means that the practice is involved, the access center is involved, the digital tools are involved, and it creates kind of a tangled mess. And so what we really need to do is move into a stage where we're not owning channels like the portal or the contact center solutions, but what we're really owning is that journey for patients. So the journey for schedule and all of the touch points and everything that it connects to. And then really understanding when is it appropriate and standard to be able to hand those off to a human. So what is that human escalation path and when should that human escalation path happen? And then really thinking about, okay, well, if we're measuring resolution in that and not just activity, then we really need to start thinking about, well, how do we measure resolution? And so of course it's about the need and understanding what the need is, and then the fulfillment of that need, but also asking like the deeper questions around how easy or hard did we make that for you? And so retail uses tools like customer effort score. We could probably introduce a patient effort score that really shows that this system is working, so that ownership end to end of these really high value, high impact journeys really moves us into that direction.
Amazing. All right. So let's move on now to our second topic, which is the proactivity and outreach mismatch. So there seems to be a massive gap between the outreach providers think that they are doing and what patients are actually experiencing on the receiving end. So Paul, we would love to hear about what the data is telling us here.
Our research shows that most providers, 56% of providers, believe they are proactively following up, but only 25% of patients report multiple proactive outreach attempts from their provider in the last year. Most patients, 51% of them, believe their health would actively improve if providers were more proactive with automated notifications. These are things like reminders, post-visit summaries. When it comes to preventative care, 67% of providers send out multiple outreaches for appointment reminders. But really only 36% of patients want that high frequency noise per se. The majority, 55% of patients, actually prefer a single effectively timed interaction.
Perfect. I'd love to bring you in on this, Michelle. So with the best of intentions, health systems are sending out more communications than ever, but patients are feeling a little bit overwhelmed. So in your experience, I'd love to hear how organizations can successfully break this cycle of more volume-based outreach and shifting to something a little bit more meaningful and patient-centric.
Yeah, so this isn't, you've got 4 statistics on the slide and they all tell 4 very different sides of the same sort of Rubik's Cube when you think about it. I want to hear more, I want to hear less. I think I'm doing it, I'm not receiving it. So when you think about the opportunity that we have with this, it's personalizing the outreach based on the patient's patterns. So if you have as an individual, if you have a high propensity for a no-show, there's something behind that. Is it more frequent reminders? Is it a technology or transport challenge? Digging a little bit deeper beneath the surface rather than to your point, you routed to the next place, but is that the right place? So digging deeper and thinking about how do you personalize these outreaches? Depending on the consumer segment, looking at demographics, looking at preferences that they have selected in, within your EMR communication preferences? Have they opted out of your marketing emails? So there's a lot that we can start to gather when you start looking at a whole patient picture or a potential patient picture, because that's also, a key facet for organizations. We want to ensure that we're continuing to grow and attract those new patients. So what we're trying to do is look at the data and see, based on all of our outreaches, where are the touch points where people are actually engaging with the thing, ensuring that once you've engaged with the single message, you're not going to get repeats or reminder follow-ups, ensuring that no matter what tool we are rolling out, we try and respect the communication preferences that are natively embedded in our EMR. And so I think it also depends on a lot, like I said, the consumer segment, the demographic, the individual characteristics of that patient. And I think that's really the next frontier, is tying all those pieces together to look at, what's the golden record for Michelle Vassallo? What is she likely to engage with? Is she ever going to answer her phone? It might be a no. Let's make sure it's always SMS. So, well, if she's opted into phone, let's have a proactive outreach about that. Not via phone, because she's not going to answer. So it's trying to be really smart with these decisions, but not in a way that you have to make them all individually. So how do we leverage these technologies to work together to be able to influence the next step in that engine, in that journey? And I love how Jill said that. We talk a lot about that on our health system side, is what have we spent a lot of time doing? We spent a lot of time just digitizing the front desk ledger, or just digitizing the way that we did something before. But now we're at a standpoint where we really need to revolutionize and look at it from the patient journey, rather than in service of the individual thing that we had built the engine to perform previously. So for us, it's thinking about, how do you be more specific and intentional by an individual patient or cohorts of patients, rather than trying these broad approaches. And in some limitations of technology, you only get a one size fits all. But where are the places we're able to plus and minus out, where someone may need a little bit more, or can, sort of silence the next bit of noise, as Paul said, in the process. So that's how we're trying to approach it, and really what we're looking forward to in the future is being able to have more personalized outreach based on the actual behaviors of the patient as we know them.
Sounds like a wonderful experience for a patient. So Jill, if the answer isn't just sending more reminders, I'd love to hear, what does that smart engagement actually look like in practice?
Well, I think Michelle covered that really well, of what like a smart individual type interaction would look like, and really making sure that it's proactive, it's timely, it's in context, all the things that you need to do for each interaction. One of the things that I challenge health systems to really think about, though, is that what is that opportunity that's lost when you have these sort of fragmented outreaches? So it may be the right time to reach out, let's say, to probe you to schedule your mammogram, or to do your colonoscopy, or to follow up with that referral. But once we have, or even pay a bill, actually, that's a really good one, is to pay the bill. But then what happens is that becomes like a discrete moment. And so when I look at this data and I see that patients don't really feel that that providers are proactive in their care, I think it has to do with, like, again, my own experience as being a patient, where I get a bill to pay, I go through all the steps. We all know that interaction could be improved in and of itself. But then it's like, well, that's the end of that journey. It didn't really connect me back into the other actions I need to take for myself. What else is going on for me? What could you do now that you have this captive audience? And so I think it really depends on us really understanding when we're succeeding with the engagement and the patient is taking the action, that oftentimes we're trying to do more for ourselves. And so I oftentimes think that when we look at how AI can support, and when we think about how we're resolving these tasks, it's like, what else can we resolve? And that really changes some of the metrics in the way that we think about this work. Because when we think about when we're doing transactions, we promote behavior to like move it along to the next stage, because average handle time is something we're trying to drive down, et cetera. And so it's like, how can you smartly look at these interactions with patients and sort of start to say, okay, now that I have you here, how do I drive what's next and best for you, and show that I know you in the context of what you're trying to accomplish for your health?
I would also add the most effective outreaches that we've seen are the ones that have the call to action and the action proactively right there. It's time for you to schedule your mammogram. We have these 6 appointments available in the next week. That goes far and above, the expectation of the patient. gets you to a much higher resolution rate, and obviously closes care gaps rather than it's time to schedule your mammogram.
Yeah.
And
we
that's
have
it.
right there for you. Yeah.
You've got to give the call to action and the action all in one outreach, and we find that to be really helpful. And tools are evolving, which makes that able to be done now, which is great.
And just think about the cognitive burden that reduces, because it's like, well, I don't have to call and find out what's available to me. I already know what's available, and I can pick, and I can do that work before I engage with you. And so it like reduces that, like, well, I don't really want to schedule my mammo because I have to like go figure out the system to find out what times they even have for me. I love that, Michelle.
Yeah, make it nice and easy for them, and then you make sure that they're coming to you and not going elsewhere to do it. So building on all of this, Daniel, I'd love to pull you in to hear how the technology can actually help do this. So that technology obviously needs to evolve to support this shift away from just blasting out reminders to really orchestrating this intelligent, context-aware engagement. So I'd love to hear from you on that.
Yeah, and I think Michelle and Jill brought fantastic points, and the technology needs to meet the standard, and the bar is not the same, right? AI is evolving, and we can do much better. I think it's clear for everybody that working with volume-based notification is not enough anymore. Systems are not in sync. It's easy to create frustration. You can get SMS, and then you get a voice call, and you get it again and again, although you confirmed already. So I think it starts with, first, how you build a reliable system that gonna create an amazing experience for the patient. That's one. Second, and I think you need to think about the patient journey. And you want to build a flow that makes sense. Maybe you start with SMS and then you switch to voice. And to Michelle's point, maybe based on demographic, you change how you communicate. And maybe different health system needs a different pattern. And all of that needs to be baked into the tech, into the product. And then you need to have this feedback loop, right? You need the data and information so you can iterate, because you can assume one thing, but then in reality, that you understand that in one area people act in one way, and in a different they act in a different way, and you need to do both, right? So that's one thing. I think you also want to change the experience where the agent is context aware. I know things about the patient. I know where you visited before. I know, to Jill's point, what's available today, what's available tomorrow. I can give you this information beforehand to get you engaged and show you that you're talking to something that is smart and not good that I ask you 20 questions. I'm giving you the information, and looking at your history to understand what is the best decision you can make, so we can get to an outcome in the end. So there is an actual action. We call it meaningful conversation, when we write the data back into the EHR. And eventually, I can share from my own personal experience. I was sitting waiting for some checkup, and the front desk, one MRI session was canceled early in the day. And I was sitting there and hearing her making like 13 calls in a row. And now she needs to talk. She's in the front desk. She needs to talk to someone. And now it's hard to provide empathy when you keep calling again and again and again, saying the same stuff and hearing no, 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 when you can build a sophisticated system that can do all of that for you, so we can protect the time of those people, so they can actually provide the care in person on time, when the automation happens behind the scene.
Amazing. And that brings us to our third topic, which is adoption and is earned through resolution. So we have already talked about this a little bit. So we've talked a little bit about proactive outreach, but what happens when the patient initiates a contact? So Paul, can you walk us through the data on what patient preferences and where legacy tech is falling short?
Yeah, I'm happy to. So we see here that 33% of patients, they still prefer their phone as their preferred way to get in touch. And only very few, only 5% still want to use those legacy text chat box. However, patients are warming up to intelligent automation. 69% are comfortable with AI scheduling. On the provider side, nearly all of them, 97%, feel their AI systems are built with the patient's best interests in mind, while about 2/3, 69% of patients are actually convinced of this. That is That's likely because most patients, 82% of patients, they still trust humans over AI to secure their health data.
So it's fascinating that patients are rejecting these old legacy chatbots, but that so many seem to have an appetite for the agentic AI with regards to scheduling. So Michelle, I'd love to hear, so knowing that this legacy phone queue still kind of holds a monopoly on patient trust, how can health systems really start to effectively build that same level of trust with intelligent agentic AI?
I think importantly, it's having quick to resolve workflows, which is only going to depend on all of the things behind the scenes. So if you've got, behind the curtains, as Jill said, if there's chaos, AI is not going to matter. It's going to be chaotic with you, and we're all going to be on this journey together. So I think one of the things that you can do is insert the agentic process prior to the person, obviously, and have a low resistance to transferring to a team member. That will build trust. It'll allow people to start the process. If they get stuck or get frustrated, it can go to a live team member who can help with that resolution. The other big advantage is my agentic agents work 24/7. My team members do not work 24/7. And so people get to experience that opportunity to do the thing that they needed to do at the time they need to do it, which also gives them a different opportunity to engage with the system. I think patients are used to using these tools, like I said, in lots of other areas. I think every every consumer website or phone system has some flavor of this. Obviously, people do it a lot better than others in different areas. We initially had to sort of train people in the introduction of things that we wanted them to sort of say to lead us to where they needed to go. And now we've been able to really ratchet that back and just go for more of a conversational flow with patients to figure out what they need and get them, to different areas of the organization, not just within a single group of agents. One thing that I think we will still have phone needs for a couple reasons. Consumer preference, and then within healthcare, there are going to be some things that are just more complex than an agentic AI agent can handle, and that may be on a clinical side, or that may be on a PHI, or sort of any of those things. So I think, again, giving patients the opportunity to wait on hold or do their thing, quick resolution in those different processes, the 24/7 availability. Again, working with your operations side to make sure that they understand when you allow this, it allows patients to do this. When we optimize this, it can reduce 30 seconds, 2 minutes, et cetera, from the workflows, and allow access 24/7. A great use case is you're seen in the ER, you break something or need something, you have follow-up, and gosh, wouldn't it be great if I could schedule it at 11 p.m. because they said I need to get seen tomorrow or the next day? That's not something you can do in most health systems, and will lead you to either finding somewhere else that you can, right, an independent practice that's got a very, very customized workflow, or you may delay care, you may be a bounce back to the ER. So when we're trying to talk to our organization about the change management around this and why it's important to adopt these tools, giving those real life examples of how this really helps patient care, patient safety, the right routing to their patients, to their clinic, et cetera. I think it helps build trust on the side, then to allow more tools to be accessible, which then builds trust in the patient experience of it. Again, like I said, it's always important to have a low burden of frustration in that, so patients can bail out. And interestingly enough, across all of our agents, we have under 3% of people that say human, person, team member, agent, representative. Under 3% go straight there. So for us, that's a great metric to keep an eye on, and it's surprisingly low because everyone knows how to beat a bot, right? They've been, every time you call the airline or the your credit card company or the cable company, people know how to beat a bot. So the fact that they're engaging and allowing us to learn right from the interactions, I think is hugely important, and that's a display of the trust that we've created with our community by taking bite-sized chunks and making sure they're successful, expanding. And again, customers in this standpoint are both sides, right? We've got our patients and we've got our internal customers, our clinics, our hospitals, et cetera. So that's what I would say about that and the trust factor.
Yeah, I think the trust is so incredibly important. And as a working mom, the convenience of being able to schedule appointments at any time of day when I happen to be up in the middle of the night is super helpful. Daniel, I'd love to bring you back in here. So, looking at the tech side, what is it going to really take for a digital AI agent to feel as safe and reliable to a patient as a human operator?
Yeah, I think Michelle called out the advantages of AI and machines. So the first one is this 24/7 notion. It works all the time. And that's a huge advantage. It's always available. But the other part of machines are not getting tired. They didn't have a bad day yesterday. Um, and they're not sad because something happened to them a week before. And what it creates is equal access to care. Everybody gets the same machine, and the machine has infinite empathy and infinite patience because it's not frustrated from the conversation before. It's just gonna talk to you. It doesn't have emotions. Although it sounds like it has emotions, in reality, it doesn't. That's how it works behind the scene from a text perspective. So I think that's one important thing that people not usually understand, and also the scale, right? If there is an extreme weather, for example, and you have a call center with humans, now it's hard to get all the load coming in. But when you have machines, you can just scale up automatically. And I can handle, instead of 200 calls at a time, I can do 2,000. So there is a big advantage of using that. The other thing is hallucinations. So, everybody knows this term with LLMs, large language models. In the end of the day, they are statistical models. So they can invent stuff. And our job in this industry is to keep the hallucination rate close to zero. It's hard, it's not easy, but we have to put those guardrails in place and measure ourselves all the time to make sure. So, Michelle called out about the 3%. You have to be transparent and show the data to your customers all the time so we can make sure that we're not making mistakes, because mistake can happen. Like human make mistakes, a product can make a mistake, and the machine can make a mistake. And I think in healthcare, more than anything, the outcome needs to be deterministic. So although you're using generative AI, you can have generative outcome. You can end up with, okay, the AI took me there. In the end of the day, there is goal, there is metrics that the health system is measuring, like no-shows that we have to meet. And Michelle talked about and gaining trust. So I think what we see is that trust, you gain it over time. And I think we see it in the notes in the chat as well. You need one good experience. So in the beginning, you are doubtful, you're skeptical, and you're asking immediately for a human agent. It's easier to talk to someone. But when it works on Saturday night when no one is available, and suddenly it understood what you asked for, and it gave you the right question, where is the parking lot? Or that I can actually cancel or reschedule my appointment, and now I can do it, although it's on Monday morning, and I talked to someone and fixed it. You need this one good experience, and then you hooked in. The same goes when you transfer someone to an agent, and we build an agent desktop that transfer all the information. So when I'm talking to my bank, they're asking me to identify, I'm giving all my details. They need to transfer it to a human agent, and I need to identify again. That creates frustration. But if I give all this information and you are transferred, say, oh, hi, Jill, I see that you try to reschedule appointment to Tuesday morning. I can help you with that. And then the conversation lasts 30 seconds and not another 5 minutes. That's how you gain trust. And then people will ask for more and more and more. And we see it in the data. Once we deploy, it takes time, and you see the numbers go up and up and up.
It's really
Amazing.
interesting, Daniel. I just wanted to add something to that. So I think trust and confidence are sort of lost in one on the basics. And so what you're talking about is really what we've seen in some of our empathetic interviews and journey mapping, that when a patient enters into the system and you sort of understand the context of where they've been and what's already happened, and you report that back to them, you're gaining their trust. And then it's oftentimes they come in with various confidence in their own ability to navigate both your system and their needs. And some folks come in knowing exactly what they want. And so they toggle between those moments or those feelings in any one interaction. And so if you're building a standard way, in your point about AI and the way that it can show up in a standard way that builds trust and builds confidence in every step of their journey, and really highlights those moments that create that trust and confidence, like repeating what you said in a way that shows that I understand your need and that understands the context of your question, so that you trust my recommendations or you trust my answers because I've collected those wins all along that journey. And the same thing, if it starts to fall back, that's when you hit Michelle's eject button, right? Like, I don't want to talk to a bot anymore. Just give me a person, right? And then you automatically eject. And so I've seen some of the Hyro pieces and how you're sort of measuring that piece of like, are we actually resolving and seeing that like rejection to a person, and really honing in and perfecting that along your own product development cycles has been awesome to see and to grow with the AI agentic model over time to really do that trust building.
Thank you.
Okay, and now we'll dive into our final segment. So looking at the digital maze versus agentic precision. So it sounds like patients are actually ready to advance with AI or agentic AI, but the bottleneck is still access. So Paul, we'd love for you to walk us through these final numbers.
Yeah, the bottleneck or the barrier, it seems to be driven both by access and also by perceptions or satisfaction with what's in place. So we see here that 90% of providers, they say that they offer 24/7 electronic access, but only 71% of patients actually agree with that. And similarly, 91%, so overwhelmingly, the most providers, they find AI voice agents to be a helpful tool for patient communication, but only 51% of patients, when we spoke to them, are generally happy with them. So again, there's this disconnect, or there's a gap here that you can see in perceptions.
Thank you, Paul. And Daniel, I want to bring you in here as well. To share some of our Hyro patient intelligence data.
Yeah, so I think what we see is that in chat, patients usually in an exploratory mode. They're not coming to necessarily make an action. So 40% of our chat volume is people looking for basic info, important navigation. And when you think about voice, most people are coming for access. So 31% of all voice traffic is patient button to schedule appointment. That's the biggest call driver. After that, you can have an appointment management when people want to cancel, verify or reschedule their appointment, prescription management, billing. But it's clear that in voice, people are in the mode that I'm going to do something. There is an action. And when I'm using chat, I'm looking for information. I want to understand what's going on. And then maybe on in the journey, I'm going to do an action. It can be in my chart. It can be making a phone call. So I think when people think about it, they need to think on how they deploy across multiple channels. So it needs to be across chat. It needs to be maybe in SMS, in voice. You can think about emails, inbound, outbound. But understand that the heavy lifting in many cases happens over the phone. It might change over time with demographics, but today, the biggest traffic we get is in voice.
Perfect. Michelle, I know that we've talked about this a bit already throughout this conversation, but we know that we have talked a lot about all of the roadblocks that make this all very complex. So since the patient appetite is clearly there, what really is the secret to successfully navigating some of these roadblocks to deploying agentic AI at scale?
I think the biggest thing is mindset within an organization. All of these things are possible, and you have to figure out I was just talking to another health system, and they were saying, how did you decide to eat the elephant? You can look at scale, you can look at willing, you can look at, highest volumes or highest frequency of things. You can look at most innovative. You can look at groups that really are broken, and you can see it through their data, satisfaction surveys, productivity, maybe new patient volume slipping or market share. So I think being really smart about what you're going to do and with whom, making those strategic partnerships within your organization, having a very clear organizational drive and vision of what you're trying to accomplish from the patient journey aspect. And then obviously every conversation that you have tying in the what's in it for them and what do you need from them. everyone owns access. I was in a service line meeting this morning with the service line president, and he said, when Michelle and her team approves, and I said, no, that's not what we need to do at all. I need you to be able to own, understand, advise, and ultimately make that decision within your service line. So I think understanding that access is not a thing, it's a strategic portfolio of work for an organization. It's the way that you're going to succeed or fail. It's the way that you're going to be able to scale a workforce to meet consumer needs and change quickly. And I think being really good about those intentional conversations and how something could help, and being able to demonstrate that with the way that you've done it in the organization. That, again, it's all about building trust, because then that leads to taking down a layer of complexity within that process to make it a fit for agentic AI. Taking down another level, trying a different tool, trying a new sort of arm off of our products. So we've found a lot of value in being bold, making large scale changes that are thoughtful and a little bit protected, and then being able to scale quickly and respond quickly. You've got to be very transparent that these are statistics, this is the correctness, the routing, the things that we're working on, constant engagement from your clinicians and your operations teams, constant feedback to them. How can we partner? How can we change? And I think we've gotten to a point now where we are getting feedback from our clinics of like, what else can you do for us, which is great. So where are those puts and takes when it needs to go to an agent or it needs to go to a front desk in this example? What are some of the things that they think, hey, I bet our agentic AI team could do this? Being able to then have another service available for patients, again, which further builds trust in the platform, which then again allows people to take down that complexity and really gives you some good momentum with use of these products. I think it's also really important to just be candid with, this is the way the world is going. There's not going to be an opportunity to opt out of AI. Otherwise, you're really going to be opting out of, kind of a competitive seat at the table for a lot of these things. And it's also the way people want to be able to do their thing. A very quick, hey, Michelle, you've got an appointment 3 weeks from now. We've got an opening next week. Are you interested? It's this date and time. Confirm here. Is so much of a different experience than missing a call from your doctor's office, trying to call back, figuring out what's wrong, what can I do, etc. So like I said, tying together a quick resolution, if it's outbound, making sure you give them the call to action and the ability to do the action all in one. And then on the inbound, trying to reduce the complexity where it makes sense. Having a lot of bold vision and courage in your own organization to decide where you're going to start and how you're going to scale. Making sure that you have a dedicated team to keep working with your vendor partners for constant, iteration and improvement. And then these things sort of evolve over time. You work on maintaining and expanding, and it gives a lot of opportunity to expand these tools to other areas that you wouldn't necessarily think about initially. And our team members have given us some great examples and great ideas. So that's how we've sort of chosen to approach things, and it's been pretty successful. And we are every day coming up with new things for the Hyro team to do. So
great, we'll do them all. Just kidding, Daniel. I didn't agree to that. So
Why not?
This is being recorded, so I've got the attention here now.
So
bring
yeah,
it on.
yeah, that was amazing. And I think so. We've talked about the complexities. I think the change management is obviously super, super important. So once you have the team on board, Daniel, I'd love to chat with you about how agentic AI is specifically built to help navigate and ingest some of that complexity and fragmented backend data we talked about to really deliver on that precision on the front end. So really being able to deliver that experience we've been talking about today.
Yeah, so I start with something that for me is more important, that you can't even achieve if you don't have it. So first, you need to be humble as a vendor. You need to identify the champion, someone like Michelle, right, in the health system. Because without it, you can't succeed. And you can't succeed because the system is complex, super busy with important work. And you need someone to align everybody on how to work within the health system. That's one, because the data is all over the place. And I think the second thing is that first start the conversation with understanding the goals. We see that different health systems want different thing. We have this saying, you've seen one health system, you've seen one health system, but think about patient experience versus resolutions. Some health systems focus more on patient experience. If someone has to transfer them immediately, um, or some other looking for automations because cost saving is the big thing right now, or we don't have enough people in the call center. The experience is not necessarily going to be the same. So first you need to identify the champion to understand what their goals are. Ask them, talk to them. They know better than you, even if you have the best product out there. Once you do that, then you can start looking at the data and understand, okay, how this data is helping me. Do I have access to all the APIs? And if not, okay, let's talk to Michelle's team and get the EHR team involved to open them up, because I can't cancel all the appointment, or I can't see some of those visit types. And then when you get all the information, and it can be scattered, right? You have information in CRMs like Salesforce or ServiceNow. It can be the EHRs. It can be PDFs that you're getting. And you need to digest all of it. And then it doesn't stop with having this information. You need to understand the workflow. How someone very smart and knowledgeable decided on the workflow for a reason. So the data needs to align to the workflow. You have to understand that having the data the data is not enough. And eventually, you need to do it when you think about security. You can't use all these AI vendors out there to make sure that the information that gets out is also the right information going out at the right time. And you have this monitoring in place that making sure that you can test yourself all the time. So we have this FAQ skill called Spot. We are testing across data set, but also in production, that over time we are getting better. And if we are trending down, immediately there is a team jumping in, understanding, okay, what changed? Is it the data of the customer side? Maybe the website was updated a day ago. Maybe it's on our side, on the product. And when you have this feedback loop, and more than anything, you have this open feedback loop with your customer and getting feedback all the time. And Michelle and I had a session 2 weeks ago about feedback on a product. That's what gets you better. And you have to be open for this. And I think that's the story. So it's not just the data. It's the whole communication and having the partner with you.
Amazing. This is a reminder that our live Q&A will start in a little bit, but before we jump to our live Q&A, so get your questions in. I wanted to do just a quick lightning round with all of our panelists. So Michelle, we'll start with you. So the question is, as we shift to a need-based model, what is the one specific administrative burden that we place on patients today that will be eliminated because of agentic AI? So we'll start with you, Michelle, and we can kind of go down the line with you all.
I think probably what I put in the chat about us duplicating work that you as the consumer or the patient have already done. Yeah, I know, gosh. I think the best thing about working for our health system is it's a regional health system. So all of us, like, you eat what you cook. So we get a lot of opportunity to test all the things that we've done. And so we're quick to make changes that we think that we should, like, filling out extra paperwork at 3 a.m. in the ER with your own kid, or not being able to schedule that appointment. So for us, I think we were really trying to have a personalization, like I talked about, sort of your golden record and how do we approach you. And then B, the second piece would reduce the administrative burden and re-burden that we put on a patient when we've already got the information that we need.
Amazing. Jill?
I was sort of laughing at the eat what you cook. I've heard eat your own dog food, and I'm hoping that in the new model, it's drink your own champagne, because we're celebrating our success in this area. I think about, for 10 years, I worked inside a health system, so I know what you mean about being a customer of your health system, and the kind of feeling that you have. Everyone in my family, everyone in my community that I know, sort of really thinks of me as, they know what I do for work, and they're like, why is it still broken, Jill? Like, why is it like this? And they share their journey of really filling in the gaps where the integrations and all the things that Michelle said. So like, why do I have to repeat what I said? Why, when I call, don't they understand what I've already done for myself? Why do I always feel like I'm starting over when I get a new person? All of those gaps will start to fill. And then and then patients will be able to start to do more of what I said in the beginning. So I think it will build towards that trust and confidence in the systems. Then all of a sudden you have an engaged patient when you're doing any one action. And so what I see happening is that we'll start to move to serving up those next best action, having more complex stories that we can hold for patients all at one time. I recently had an appointment where I got 4 actions and each one had a different little journey. I would love to know what the next best action is for all of them and solve the next step for every single one of them. And so I think as this evolves, and I actually, for 10 years of being in a health system, and then now for about 3 years doing this across clients, with the advancement in AI, the backbone technologies, people using more service design, doing more journey mapping, really putting themselves in the place of the patient, more of what Michelle you're describing of sort of like centralizing the access conversation so that all of the unique owners are having a framework to talk about access and pick and select those tools. And so I just feel like it's all coming together. It's a great time to be in healthcare and to solve those challenges that a lot of us have been thinking about wanting to solve for so many years. And I think the patients are really starting to see the benefits, and we just need to keep building on that momentum.
So thank you all for the incredible lightning round insights. It's really inspiring to really think about the future of where patients, how we can start to really unburden these administrative mazes to really make access easier for patients. So we have a couple of more minutes. Let's see if we have any questions from the audience. So how can the industry create value and trust with medical office communication? Anyone want to volunteer?
I can volunteer for part of that. I think one of our biggest opportunities is having the context, making it very timely, and if there's an action that needs to be done, being able to connect the narrative with the action. So if you think about, my chart message center, you're talking, I'm having these symptoms, I don't really know, blah, blah. I think you need an appointment. Okay, well, now I got to start the whole appointment journey, to Jill's point, whereas there's not that embedded maybe next step. And so I think that is one piece. Timeliness is certainly a piece of it as well. We don't have folks necessarily sitting at their desks waiting to respond. So is this an opportunity for more agentic AI support where you can look at context? If it, we're able to determine that a patient needs an appointment. I'm not talking about medical triage, obviously, but if there's enough things mentioned in a single narrative, you could probably assume I'm going to need to see you, map that office visit, and offer right then in those replies some opportunities to have that next appointment. I think those sorts of things would really be intelligent solutions that people would be like, wow, this is so different than my current experience. This is great. But definitely timeliness, and that's the biggest thing for us.
I'll just add to that, just sort of saying that the bar is really low to blow them away.
Yeah, that's
right?
True.
And so going back to that, trust is built on the basics. It's like when you do have those call to actions, when they do have them make it go all the way through. So the story that you shared of being able to schedule, surfacing the amounts, surfacing the times, and then when you click on it, it works. That's a an obvious answer, but it doesn't always work. And so that's really one of the core pieces.
Amazing. Thank you all for your amazing insights. This brings us to the end of our hour. I want to give a massive thank you to our incredible panel, Michelle, Paul, Jill, and Daniel, for helping us unmask the reality behind some of these operational bottlenecks today. A big thank you to everyone in the audience. Thank you for being engaged. Thank you for engaging in the chat. We really appreciated it. As a reminder, we will be sending an email to your inbox with the recording of today's session, as well as a direct link to the report. If you're ready to start moving your own health system away from digital maze toward agentic precision, please reach out to us at Hyro. We would love to help you build that roadmap. Thank you again for taking the time and spending time with us today. Have a wonderful rest of your day.